Hey everyone, it's me Adam. This is my medical series. Subscribe. We will be going over the most dangerous health conditions ever. If you feel like I made a mistake, let me know in the comments below. I would love to hear what medical content you would want to see. 10. Flu. So we all know that the flu is horrible for some, it can be dangerous, but most likely it isn't. But this condition is one of the most serious for complications such as myocarditis, encephalitis, meningitis, sepsis, and death. But it's only low on this list to the strong vaccine you get for this every year. It doesn't stop it from happening, but it does lower the chance of how bad you get it. 9. COVID 19. COVID 19 has killed over millions of people every year and is still going strong, but due to the vaccines, it's not as bad as what it was during its first few years. This infection or illness is super bad for complications, and even the symptoms of this condition is terrible and miserable. The complications are as followed. Acute respiratory failure. When you have acute respiratory failure, your lungs might not pump enough oxygen into your blood or might not take enough carbon dioxide out. Both of these problems can happen at the same time. Acute respiratory failure has been the leading cause of death for those who have died of COVID 19. Pneumonia. Some who catch the new coronavirus get severe pneumonia in both lungs. COVID 19 pneumonia is a serious illness that can be deadly. When you have pneumonia, the air sacs in your lungs become inflamed, making it harder to breathe. COVID 19 is the illness caused by the virus SARS-CoV-2. As a viral infection, COVID 19 can lead to sepsis. People with severe COVID 19 may experience symptoms such as fever and chills, difficulty breathing, pain or discomfort, and confusion. These are also common signs of sepsis. All this information about these complications were copy and pasted from Google as it was the only way I could get this done at time for you, my fans, to be able to watch this sooner. Let's move on. 8. Hyperthermia. Hyperthermia can be caused by many things such as flu fever and even being out in the heat for too long. It can also be from serotonin syndrome and even thyroid storm. This is very serious and is very fast progressive condition. This can kill if left untreated. The symptoms are horrible. A temperature of 40 C 104 F or higher is life-threatening. Confusion, nausea or vomiting, and rapid breathing are some symptoms. People may experience whole body dehydration, fatigue, flushing, thirst, excess sweating, fainting, inability to sweat normally, lightheadedness, low blood pressure, or nervous system dysfunction. Muscular, cramping, stiff muscles or muscle spasms, gastrointestinal, nausea or vomiting, respiratory, fast breathing or shallow breathing, also common, elevated core body temperature, fast heart rate, delirium, dry skin, headache, or mental confusion. The complications are just as bad. If not treated promptly, malignant hyperthermia can result in major complications, such as a rare condition that causes muscle cells to break down, rhabdomyolysis, kidney damage or failure, problems with clotting and bleeding. 7. Sepsis. Sepsis is a life-threatening reaction to an infection that has entered the bloodstream. It can attack any organ, mainly the kidney, and can kill in under 12 hours or less. The symptoms are the worst out of all so far. Whole body, low blood pressure, chills, dizziness, fatigue, fever, flushing, low body temperature or shivering, cognitive, altered level of consciousness or mental confusion, respiratory, fast breathing or shortness of breath, also common, delirium, fast heart rate, insufficient urine production, organ dysfunction, skin discoloration, or sleepiness. Some possible complications of sepsis are kidney failure, tissue death, gangrene of fingers or toes that may require amputation, permanent lung damage from acute respiratory distress syndrome. 6. Narcotizing fasciitis. This is an extremely rare but yet the most gruesome condition out there known to date. The condition spreads quickly. Symptoms include blisters, fever, fatigue, and pain worse than a person would expect based on the wound's appearance. People may experience pain areas in the skin, whole body, fever, chills, fatigue, or low blood pressure, skin discoloration, redness, blister, or crackling sensation under the skin also. Common, swelling, kidney failure, nausea, or pus. If not treated quickly with antibiotics and/or debridement of the infected tissue, the patient may develop toxic shock syndrome or toxic shock-like syndrome. Complications that may result from this condition include infection that spreads throughout your body, causing a blood infection, sepsis, which can be deadly. It can also result in lifelong complications from loss of limbs or severe scarring due to surgically removing infected tissue. Looking at data from the most recent 5 years, even with treatment, up to 1 in 5 people with necrotizing fasciitis died from the infection. In the most recent 5 years, the mortality rate of necrotizing fasciitis ranges from 11% to 22%. Coincident necrotizing fasciitis and streptococcal toxic shock syndrome (CES) have a mortality rate ranging from 16% 33%. Extensive surgical debridement and amputations are not uncommon. So yes, this is one of the most highest mortality rate infections ever, as many of the others either have a vaccine or isn't as strong as this one, but they may also be just as bad for complications and symptoms, but not for the mortality rate, as the mortality rate for many are like 5 minus 10, but for this is 10 minus 33 mortality rate. 5. Encephalitis. Requires a medical diagnosis. Mild cases may cause no symptoms or mild flu-like symptoms. Severe cases can be life-threatening. Immediate medical attention is needed for symptoms such as confusion, hallucinations, seizures, weakness, and loss of sensation. Can have no symptoms, but people may experience pain areas in the muscles, whole body, fatigue, fever, loss of appetite or malaise, muscular, muscle weakness, problems with coordination, rhythmic muscle contractions or unsteady gait, cognitive, altered level of consciousness, disorientation or mental confusion, gastrointestinal, nausea or vomiting, psychological, delirium or hallucination, also common, irritability, light sensitivity, headache, stiff neck, reduced sensation of touch or seizures. Left untreated, autoimmune encephalitis can quickly become serious. It may lead to coma or permanent brain injury. In rare cases, it can be fatal. These are the complications. 4. Meningitis. Requires a medical diagnosis. Symptoms include headache, fever, and stiff neck. People may experience pain areas in the back, muscles, or neck, whole body, fever, chills, fatigue, lethargy, loss of appetite, malaise, or shivering, gastrointestinal, nausea or vomiting, skin, blotchy rashes, or red rashes. Also common, irritability, mental confusion, sensitivity to light, stiff neck, bulging fontanelle, fast breathing, fast heart rate, fear of loud sounds, headache, lack of interest in feeding in infants, sleepiness, sluggishness, or stiff back. Previous studies have identified that systemic disease complications, septicemia, and respiratory failure was the primary cause of death among elderly. Hearing loss, seizures, limb weakness, difficulties with vision, speech, language, memory, and communication, as well as scarring and limb amputations after sepsis. This can cause sepsis. 3. Abdominal aortic aneurysm. This is super rare but yet very destructive to the aorta, which supplies blood to the heart, which is the most major heart helpers in your body system. Requires a medical diagnosis. An abdominal aortic aneurysm often grows slowly without symptoms. As it grows, some people may notice a pulsating feeling near the navel. Pain in the back, belly, or side may be signs of impending rupture, can have no symptoms, but people may experience pain areas in the abdomen, back, or flank, also common. Nausea or pulsating abdominal mass. Bleeding, limb ischemia, delayed rupture secondary to endoleak, abdominal compartment syndrome, myocardial infarction, pneumonia, graft infection, colon ischemia. The overall mortality rate of ruptured AAA-RA is 80-92. A lot of patients with AAA remain asymptomatic until rupture occurs, which means the rate for the death rate is 88 to 90%. 2. Boerhaave syndrome. This is one we talked about on a video on this medical series. Effort rupture of the esophagus, or Boerhaave syndrome, is a spontaneous perforation of the esophagus that results from a sudden increase in intraesophageal pressure combined with negative intrathoracic pressure, severe straining or vomiting. Symptoms and causes: sudden severe chest pain, nausea and vomiting, pain or coughing when swallowing, short, rapid breathing, swelling in the tissues of the chest cavity with air or fluid, hard, rigid abdomen, signs of infection like fever and sweating. Syndrome is an uncommon condition, so the diagnosis can easily be missed or delayed, leading to complications like dehydration, mediastinitis, sepsis, and shock. Other complications include acute respiratory distress syndrome, pneumomediastinum, pneumothorax, and hydrothorax. Diagnosis should include Mallory-Weiss stare, esophageal intramural hematoma, peptic ulcer disease, and its complications such as bleeding and perforation. Conclusion: Boerhaave syndrome, it's an infrequent pathology with mortality rates ranging between 30 and 50%. 1. Rabies. A deadly virus spread to people from the saliva of infected animals. Rabies is usually spread through an animal bite. Animals most likely to spread rabies include dogs, bats, coyotes, foxes, skunks, and raccoons. In all animals, initial signs of rabies may include fearfulness, restlessness, increased or decreased appetite, vomiting, diarrhea, a slight fever, enlargement. Signs progress within days to cerebral dysfunction, cranial nerve dysfunction, ataxia, weakness, paralysis, seizures, difficulty breathing. Anyone with a possible rabies infection must be treated in a hospital. Call local animal control authorities to help find the animal. Once rabies shows symptoms, it can't be treated, so it's important to call your vet as soon as your dog has been bitten instead of waiting to see. Back away slowly. If you think an animal might have rabies, contact local wildlife officials immediately. In general, you should leave any wild animal alone, always according to Mike Schiavone, a wildlife biologist with the deck. However, animals with rabies may act strangely. Some may be aggressive and try to bite you or other animals, or they may drool more than normal. This is sometimes shown in movies as animals foaming at the mouth, but not all animals with rabies will be aggressive or drooling. If you've been bitten by an animal that is known to have rabies, you'll receive a series of shots to prevent the rabies virus from infecting you. Call your doctor right away and go to the nearest emergency department. Anyone with a possible rabies infection must be treated in a hospital. Even if you have been bitten a few days or weeks ago, it is never too late to start. Rabies virus can incubate for several years before it causes symptoms. If you wait until you get symptoms, it may be too late. There is no treatment for established rabies. Rabies is fatal. Requires a medical diagnosis. Symptoms include fever, headache, excess salivation, muscle spasms, paralysis, and mental confusion. People may experience pain areas in the muscles, whole body, dizziness, fatigue, fever, loss of appetite or malaise, psychological, delirium, fear or hallucination, gastrointestinal, nausea or vomiting, muscular, muscle spasms or paralysis with weak muscles, sensory, pins and needles or sensitivity to light, behavioral, aggression or irritability. Also common: anxiety, brain death, coma, difficulty swallowing, dilated pupil, drooling, excess salivation, headache, mental confusion, seizures, or stiff neck. Complications: seizures, fasciculations, psychosis, aphasia, autonomic instability, paralysis, coma, death. Fever, paresthesia, nuchal rigidity, muscle fasciculations, focal and generalized convulsions, hyperventilation, and hypersalivation may occur in both forms of the disease. At the end of the acute neurologic phase, periods of rapid, irregular breathing may begin. Paralysis and coma soon follow. This is the final stage of this terrible disease. Human rabies is 99% fatal. However, it is 100% preventable through vaccinating pets against rabies, avoiding contact with wildlife and unknown animals, and seeking medical care as soon as possible after being bitten or scratched by an animal. Why is there no cure for rabies after symptoms have shown? Why is there no cure for rabies? There's no cure for rabies once it's moved to your brain because it's protected by your blood-brain barrier. Your blood-brain barrier is a layer between your brain and the blood vessels in your head. So let's rank them from least to most dangerous with mortality rate. 10. Flu highest mortality rate is for 65 plus or older at 26.6%. 9. Encephalitis at 40%, which is the highest mortality rate. 8. Boerhaave syndrome at 50%, which is the highest mortality rate. 7. Sepsis mortality rate highest is 40%. 6. COVID-19 mortality rate, which is 61.3 of the highest mortality rate. 5. Meningitis mortality rate is at 70% in treated. 4. Narcotizing fasciitis highest mortality rate at 80%. 3. Hyperthermia mortality rate is 90%. 2. AAA mortality rate is 100% if left untreated. AAA means abdominal aortic aneurysm. 1. Rabies at 100% once the symptoms start to show. If you enjoy this video and medical series, make sure to subscribe for more.